globally, nobody really understood like nursing informatics, that it was a third information science, a third computer science, and a third advanced nursing. So in the process of like learning how to code, how to design, the UX, the research, just every little element that you have to think of, making sure it's ADA and CDA compliant, and just little by little patching it together, and then creating my whole social media around that site, making the brand InnoNurse, getting a bag so people could find me, because it's such a big conference, such a big area. Not everybody can find you. You change your hairstyle, nobody knows who you are. So the process of designing InnoNurse, creating InnoNurse has kind of unfolded, and now it's seen in 90 different countries. So going from being a bedside nurse where you're touching people and to becoming a nurse in informatics, I would travel the world and just nicely ask, can I come into your hospital in Belize? Can I come into your hospital in Spain or France or Estonia, Malta? Can you show me around? And they did. And to see what was happening in health tech around the world inspired me. So I'm back my master's in nursing informatics at UPenn. Then I rediscovered a whole host of things I didn't know, from health promotions, project management, health IT, medical economics, UX design, database management, and then this whole process of creating InnoNurse while I was in graduate school. So time I actually graduated, I actually had my own brand, my company, my own business. It's a workflow. Like someone said at one of the conferences, instead of us trying to get a seat on the board, like that should be our table. Why are we trying to get a seat on the board at the hospital when that should be our table and our board, and we should be managing? Because we're the ones that actually care for the patients, do the workflow, do the design. Especially in nurse informatics, you're working with IT, you're working with doctors and nurses and structure. I was in France recently and was talking with an architect, and talking about how he needs more nurses to work with him in architect designs for hospitals so they can have the right patient flow for the units. I was like, brilliant. I think nurses are, looking to getting, involved in design and architecture from the healthcare and the clinical standpoint.